to episode 3 of the Sunday Soul Search. I am Jane.
And I am Polly.
Thank you for joining us again. And if you have tuned in to our episodes 1 and 2, which was like a part 1 and 2, we touched a little bit on mediumship and who you want to sit on the bench with a loved one or celebrity. And we talked about different mediumship sort of developments and how people get into it. It was lightly touched on that, and we will talk about spiritual stuff down during our podcast, but we are going to talk about everyday topics as well. So there is nothing that we're not going to talk about, is there?
Absolutely.
But we've both also, so we'll excuse our demeanour, we've both also not had much sleep. We didn't get to bed till 4 a.m. Not together this. We weren't not together this time. We weren't away. We weren't away this week working on any events and being tight and sharing the costs of the room. One was on holiday. One has actually spent a lot of time the last 24 hours in the NHS hospital beds with her mum. But you can tell by the colour of our skin which one's been on holiday and arrived back late and which one's been up all night in the hospital.
It definitely wasn't me in the hospital.
Yeah, so today we've moved our episodes around a little bit. We've got lots of things that we're going to talk about and discuss over the period of time, but while we're recording today, because as you know, these don't go out till Sunday, you will see it on Sunday, but we pre-record them. So we are going to talk about today
the NHS.
Yeah, and the reason being that, Polly, because I love it.
Because for one, Miss Morton here actually worked for quite a long time throughout lockdown, wasn't it?
During lockdown and beyond, and I've been gone nearly 2 years Christmas Eve.
Poor Jane, and Jane, one of Jane's relatives, has been in hospital last night and not had necessarily a great experience. So we thought that we'd talk about the NHS today and just discuss our view. And like we always say, it's our view. When we do put this out, please do feel free to, comment on any experiences that you have. We do look at them. We do read them. So the NHS. So, I'll say a little bit. Luckily for me, touch wood as well, I haven't had too many bad experiences, and the reason why I haven't had too many bad experiences, well, one particularly bad experience, I guess, is because I'm very thankful in the fact that, nothing serious maybe has actually happened. And like I said, touching wood, that it won't. For just going back, basically, I had a bad experience for the fact that, going to the doctors, and this is before all the lockdowns, this is like about sort of 9 years ago now, where I suddenly started being very ill, lost loads of weight, and even though I've put a bit of weight on holiday, which I can't deny, I was losing weight for, I said, no reason. My hair started falling out. I was like feeling like it was like a skeleton. Everyone was like saying thought I had some sort of eating disorder. In fact, I was eating piles of food and feeling like I was malnourished, that sort of thing. Took 14 months for them to decide that I was actually celiac, and basically it wasn't, I got all these questions. Are you depressed? Have you got anxiety? But I had depression and anxiety for the fact that I was ill and no one could tell me why. Had every single test that you could possibly have, apart from the one I was supposed to have. And then by the time they wanted to do the test for celiac disease, as soon as I started eating gluten again, all the problems started again. So I could not do 6 weeks of eating 4 pieces of bread. So they, basically in the end had to say, treat me as celiac, because it's without a doubt I am. But that's 14 months is a long time to be.
But then I think the average diagnosis these days on general stuff, I'm not going to say serious stuff, but everything can be serious. It's around 18 months it used to be. So it's probably longer now with what's going on these days. So yeah. So you've not had you've been lucky because you've not had any bad experiences, have you?
Not really.
No. You've not had any hospital admissions, have you?
Not
apart from having children.
Only minor things, when I say minor, I've gone to the eye hospital. I go to the eye hospital a lot because I have problems with my eyes, but they've been amazing. I've got to be honest, the eye hospital in our local hospital have been absolutely amazing with me. Other bits and bobs, gallbladder, that sort of thing, but haven't had it out. Touch wood, won't.
I have.
And on the flip side, we've got Jane here, who I call the Terminator, because I don't think actually there's many organs of her own in there anymore.
Well, I've paid my stamp for over the years. I've got full pension now, apparently, according to the state. So I just like to use the NHS service. Now, all jokes aside, I in the last 5 years, alone, I've had a fair few surgeries, haven't I, for one thing or another. And some of them have been a little bit hairy, but only because they found out I was allergic, highly sensitive to general anaesthetics. So obviously, that leads to a few problems when you're having a little crash on the operating table. But we've hopefully overcome that now. But for me, one of the reasons the topic comes up, and we do moan about in general, like, and this isn't just about hospitals, this is about this is from your GP practice, your pharmacies, the online systems. They're trying to get an appointment. They're trying now to get your pharmacy's medication because you have to put it online, and then it's like a 48-hour window now. What happened to the good old days when you went in the doctors, you came out, you walked around your local chemist, popped it in, they go, you wait in, go, well, I'll just nip up the butchers, and then I'll be back and collect it. Can't do that no more. It's all online, and when you go down, they go, no, we only got it this morning, come back in 48 hours. And if you needed it, tough really, because that's what I've been experiencing lately since I was admitted earlier in the year with pneumonia. No one seems to want to give me my asthma spray on time. It is my steroids. It's been up since I was ill. Really do need it. Don't understand how hard it is to get it off the shelf and pop it in a bag. But anyway, that's only one of my minor experiences. I think for me, I did work for the local emergency hospital, and people thought I was crazy. It was after I severely broke my leg, struggling with my mobility, still struggling with my mobility. And obviously I was in the hospital during COVID, so I had my own opinions of that because I was in there, in the heat of it, shall we say, or not. Make your own mind up on that. But I went and got a job there. I don't know if that was the PTSD that apparently I got diagnosed with. So I was, why not? Just throw myself back in where it upset me. But I worked with a great team, and a lot of, I'm going to say 90% of the team, whatever department you're in, are hardworking, they're dedicated, and they really are trying to do their best. But they are exhausted, they're underpaid, there's too many cuts, there's too many demands, and there's too many targets. And a lot of it's become almost, it is about targets. It's like the education. We talked about that in the last episode. People are meeting targets and forgetting there's a patient involved. Because of that, I became a patient ambassador while I was at the hospital. And my boss thought I'd be good at it because I was so outspoken. But I was all about the patient while I was working there. But I see things that obviously I was not happy seeing sometimes, and it does take its toll on it. So anyone that's worked for years in the NHS, I take my hat off to you because it isn't an easy job. I was in emergency medicine, so obviously that was demanding. And I'm not a nurse or a doctor, people, because I wouldn't be doing podcasts like this if I was, because I'd be busy. But no, all jokes aside, I worked in a busy ward. I was the ward clerk. I chose to do that job, and I was part of the team, and I was running around a lot. So I've seen good, the bad, and the ugly. Is the only way I can describe it. I've been a carer for my dad when he was ill and sadly passed in hospital. I have been a patient, and I have been the employee. So I've seen every angle, everything. And I think when I used to talk to visitors and patients, I got that because I've been them in that bed. I've been the visitor, the relative that's worried, but I also work and understand a little bit more about what goes on behind the systems.
It is really hard, isn't it?
I'm just having a little drink out of my cauldron cup because remember, I'm still a witch.
But it is really hard, and what really frustrates me, I mean, I'm not a great techie person, as you know. As anybody that knows me knows, I am crap on a piece of technology. Hence the reason why this lovely lady here does it all.
But I'm not very good at it either, but I'm better than her.
What really frustrates me is the fact of getting a doctor's appointment in the first place. Because for one, there isn't any. For two, it's like we're so overpopulated. I mean, I don't know where you guys live at home. Please do let us know. But we live in Portsmouth. I mean, the population of Portsmouth is huge, and we've got one main hospital, haven't we?
Yeah.
That actually covers Portsmouth, Gosport, Fareham, and surrounding.
There's 980 something beds now in our local emergency general hospital. It used to be 1002 when I was working there, so I'm wondering what they've done with the beds. But apparently, my brother looked it up last night while we were sat in resus with my mum, because he's a little bit like that, my brother. He's a little bit more straight-laced, shall we say. He's not as woo-woo as me. But yeah, that's a lot. That's not a lot of beds for the surface area. Absolutely, and I know the surface area goes quite far. And yet we've got those other hospitals. But that hospital that I was at last night has a massive surface area. So how are people going to meet? They're not going to meet the demands, and patients are not always going to get help. We were in an ambulance outside the hospital. We were sat. The ambulance team were brilliant. Got us a cup of tea, which was nice. We were sat in a queue waiting to go in, but Mum actually queue jumped, as I did myself earlier in the year, because obviously we were both poorly. And they do prioritise patients. You know, I know it's not nice for people waiting, but if you're poorly, you're poorly, and you need assistance, you need it now. Like I said, I've seen everything that's gone on. But do you know, and I said this when I worked there, she thought I was mad. She kept telling me to leave. Why are you still working there? Why are you still doing this?
Because it was stressing her out.
And I had personal stuff going on, and obviously, again, that was another section of the NHS. I was dealing with somebody in my family with mental health, so I was dealing with the mental health aspects of the NHS. This person was he won't mind because he knows we've talked about it, so it was my son. He became a patient, and sometimes on my department, so that wasn't ideal when you're working there. So I had the mental health side of the NHS that I was dealing with, then going into emergency medicine on a 12-hour shift, working that. I was exhausted because I'm obviously I am deemed medically unfit because I've got a disability. I'm stubborn and whatnot, and I keep going, don't I? But it was draining me emotionally because it's so hard. But I have seen so many different aspects of the NHS not getting the right support, and mental health, adult care is one of them.
No, I don't think any of them are, but mental health, which is a whole other
ball game. All right, but it's not when you're in general medicine.
Is so under-resourced. I mean, people are waiting, and some people are suicidal and waiting for, one, it's getting a doctor's appointment, then two, being referred to some sort of either psychiatrist or counsellor or what's the team called? I can't remember, the crisis team. And literally, I mean, certainly since the COVID episodes, people haven't coped. They've lost everything. They can't cope. They can't afford anything. They're not getting the help they need. There's poverty, huge poverty around. There's people that aren't supported, or luckily, your son's been very lucky in the fact he's got you. He has.
He might not think.
Yeah, but he has. But there's people out there who haven't got anybody, and some people, if they're in such a poor mental state or vulnerable, they're probably not going to even be thinking about phoning a doctor. They're bypassed that. Not. But, if they are lucky, like I said, and they've got somebody like you or a carer or somebody around them that can help them and push them for that and get the right services involved, that's great, but it's still taking far too long.
It is. And like I said, on the personal side, what I've had to endure, what I've had to fight, even in the mental health team, in the psychiatric part and all that, the things I've had to do to get my son's care has been unreal. What I've witnessed, what I've seen with other people, it's made me realise people are very lucky when they've got support and when they've got family to support them, but there's too many people out there that haven't got support, and that is not good. And it is the same as when people get admitted into hospital in an fire accident emergency. Well, it's not accident emergency no more, it's an emergency department. And then they end up in general medicine because they've been assessed. Some people come in, they've got no one visiting.
Absolutely no one.
And they certainly didn't have in COVID.
So the elderly, got literally no one, and no one to take care of them outside the hospital, no support.
And it's really sad to see, and that's why sometimes the care slips. And obviously in COVID that was awful because there was no visitors, and it broke my heart. I mean, I used to take the mobile phone and go and let them ring their relatives. They liked it disinfected and 3 bags deep, but I just thought these people are being totally cut off again, and they need to talk to someone. I know from being in there with my leg when I broke it, to not have anyone visit you. I was in there just over 2.5 weeks. No one visited me. I at one point couldn't talk to anyone because I was so traumatised anyway, and obviously in shock and waiting for surgery. I was lucky because I had a friend that worked in the hospital, and she used to come and visit me daily to see if I wanted anything. But people had nobody. And in our little ward, we set up a little community amongst ourselves, the patients, and we all looked out for each other and talked to each other. But, there's so many different aspects to it. But going back to the GP surgery, because this is where I get angry.
I'll tell you what, I want to have words with whoever. I don't know what service you guys have out there, but locally we have an Anima app, and I want to actually have words.
I think everyone's got this online system, haven't they, now? But my mum can't use an online system. She has to still physically ring and sit in this queue of, I think it was 18 when I tried to ring yesterday. 18 in a queue in the afternoon.
But the questions that they ask.
Oh, no.
On the app.
If you go too far, you're going to end up having an ambulance sent your way. But you just want to be treated. You don't necessarily need to be in hospital.
One time, I had filled in the things to say what I'd got, and it said, "Do you have pains in your chest?" And I had said yes because I had, right? So then it's like, ambulance being called, and I'm having to phone them to cancel an ambulance, which I didn't want. I did know that I had pains in my chest, but it didn't give you any option from 1 to 10, or, is it related to the other thing? It almost just like heard the warning sign and was like ready to call the ambulance. And I'm like panicking that an ambulance is going to come, which there's no need for. I just wanted an appointment because of
But it's a generated system, and obviously AI is involved, so it's going one way or the other. And, it's just stupid. Yesterday, what really got my back up is that my mum would refuse to let me ring her an ambulance. She's quite stubborn. I just honestly don't know if I'm take after my mother or father. Both are stubborn. Because she was obviously within her faculties, I had to respect her wishes. She could walk. I did a few little things on her to see how far she'd gone. She'd had a fall. But I still believe she needed an ambulance. But she was absolutely adamant no. So I said, right, I'm ringing 111, which is a thing we use in the UK, to get them assess you. And she said, oh, no, she needs to go to the treatment centre. And I went, well, I think she needs an ambulance, because I love to disagree. I mean, it's not like I've got a medical degree or anything.
You should have a medical degree
in body organs and what's. Well, I did do house studies.
No, I was going to say in complaints.
Yeah, in complaints. I'm good at complaints.
A degree in complaints, generally getting a master's.
In fairness, I did house studies in uni because I've always found I love biology in school. I've done house studies in uni, and then I went on to do my anatomy because I'm a holistic therapist. So I had to learn about the anatomy. I'm a vitamin technician, I'm a phlebotomist, so I can use cannulas and needles. So I have an insight, and I've worked there, so I've learned all the terminology, and I've sat with the doctors, and it's amazing what you learn. But no, I'm not a nurse, I'm not a doctor. I have no medical training that way. I have anatomy training, but also I've got common sense, and I know when someone's unwell and when they're not, and when they need help and when they're not, and that's just common sense in my book. And I think there's a lot of things that have gone out the window with common sense in this world. My 111 said it had to be the treatment centre, so I had to go along with it. And I had to get her in my car, and she was in absolute agony. I knew she was in agony, and I had to get her in my car and take her down there. And when I walked in, I was mortified because people were sat on the floor outside the car park. They were sat in the gangway. There was just people everywhere. There was like hundreds of them. It was 3:00 in the afternoon, and I know that if I'd gone to my GP surgery yesterday to have a routine blood or my asthma check, when they get called in, there's no one sitting in that surgery. There might be another person with you, but there's no one sat in there because apparently they're really busy. And I don't get.
I'm surprised they've even got jobs anymore.
Well, we know there's not a lot of doctors behind the scenes, and that's the problem. There's probably not a lot of GPs in the practices, and that then restricts how many. And there's more nurse practitioners being trained up. I noticed that in ED as well, and I noticed that before I left, and that's good, because they're really, really good anyway. But you go into your GP practice and it's really quiet, and you're sitting there thinking, oh, it's quiet. So why is it you can't, after 8:00 in the morning, if you haven't got on the online system quick enough, you can't have an appointment? Like the good old days.
A lot of them are phone calls now.
But you still don't get out on the day. If you miss it, not mine. If you miss the deadline,
we do. But I just think again. I mean, if I say, it's like I've said, I've had a couple of bouts of like tonsillitis and ear infections over the last couple of years, but if I say I've got this, they'll say, okay. They don't even argue my own diagnosis, which is really funny. I mean, I could have something really bad going on down there. Do you know what I mean? But they're like, go to the chemist, go to the pharmacy, and they'll take a look. So I've been down the pharmacy and I've said, okay, the doctors have sent me down to you because they said you can look down my throat to see if I've got tonsillitis. And they went, no, we don't do that.
I know. They're all passed up.
They say you need to go back to your doctors. Yeah. And I said, but the doctors told me specifically to come to your shop, and they've made me an appointment with you, and you won't look in my throat because you don't want my germs, which I totally understand. Not in your job description. Anyway, and then they don't even see me and give me some antibiotics.
So you're lucky, because my doctor would just go, ring back tomorrow, put the phone down, and then if you go in there, they go, you don't know what stress we're under. Now, come and do a 12-hour shift in emergency medicine and then talk to me about stress, because I'll tell you what, must be a breezing. I'm not saying they don't get people abusing. I'm not saying that. And I've got people that work in the doctors, so I know they do. I've got friends that work there. But a 12-hour shift in real medicine is demanding for all participants. But I noticed it when I worked in the hospital, and I certainly noticed it yesterday. My mum sat 5 hours in a treatment centre, and I didn't even realise, because she didn't tell me, when she was triaged, that they already worked out she had low oxygen levels and high blood pressure. She suffers with neither respiratory or heart problems. And 4 hours later, when she got seen, after they'd locked the doors and they basically said, oh, you've got to go out the back way after this because, we're finished, they realised she needs an ambulance. And I'm fuming. because the triage should have realised that 4 hours ago, and I actually told them, why was she not seen before? Because people younger and fit were going in before her. And yes, so an ambulance, and she ended up in the hospital I worked in, and I can't fault the care there, and I can't fault the care of the nurse practitioner at the treatment centre that actually sorted all that out. But that process from not getting to the GP, which the GP would have sent an ambulance years ago, GP would have gone, oh, that's not good, let's get you an ambulance. But you can't get to the GP, so they can't get the ambulance. But the process of getting in the treatment centre in the middle of the day and finally getting to an emergency department in the evening, I think we got there at 9:15 in the evening. How has that broken down? And people shouldn't be reaching emergency level because the middleman's cut out.
Yeah, we were saying yesterday, I mean, and when we say all this, we know there's some amazing people that work on 111. We know there's amazing people that work in doctor surgeries, and we know there's amazing nurses, doctors, and we know they're under stress, like we've said before, and amazing people.
It's the politics behind it.
It's the politics.
And I don't care if that upsets it. It is the politics.
And the system, which is messed up. And I can be honest with you, and probably a lot of you think this as well, is that basically the powers that be just want us to go private and get rid of it. And basically, that's what I reckon.
When I was working at my hospital, before we went digital pay slips, I used to get my pay slip in the little, the perforated envelopes. We had to break it along and hope it didn't rip. And inside, sometimes we'd have it in another envelope. And I thought, was it an envelope, not the computerised system one? And inside the envelope would be an information slip for private healthcare. That says it all, doesn't it? You're working for the NHS and they put private healthcare slip in there. I was like, wow. But not everyone. I can't afford to go private.
Oh, nor can I.
And I've got ongoing conditions which affects private healthcare now. So they would go, oh, no, we can't do that because you've got ongoing conditions. So it's not acceptable. And people that need it, and the most vulnerable are children and older people. And then I'd say the mental health category. Mm-hmm. And there are a lot of people that won't speak up. I mean, I do speak up, and anyone that knows me knows I do, and I will speak up.
I know you speak up, my love.
But I also speak up for other people, and I've done that when I've been a patient. I've spoke up for other people because I just get so passionate about it. But it still goes back to my treatment back in January when I was obviously blue lighted to hospital because my doctor wouldn't even listen to me, and I don't even go to him, but he still wouldn't listen to me when I told him I was ill. He dismissed me. Then I ended up seriously ill in hospital. I just find it frustrating because my treatment there was phenomenal. They were really good with me. My mum's treatment is really good. I've watched treatment. I've watched patients as an employee. Everyone's good. They are stressed. They are tired. Things can get missed. We're only human. But it's that GP thing. It still niggles me. It niggled me in COVID when all the doors got shut and screens went up.
Oh God,
you can't
absolutely.
go in.
Honestly, it infuriates
I
me.
know there was a lot of busy surgeries back in the day. I remember when my kids were young, I'd walk round the corner and go and queue up before the doors opened to book my appointment for the day because I lived locally like you did in them days. And I'd book an appointment, say, later in the afternoon, and I'd go back round, sort the kids out if they were at nursery or at school, and then go back and do my appointment. You can't queue up outside no more. That's a no-no. And I remember sometimes sitting in busy GP surgeries with cough here and whatever. I know we don't really want to sit with people that are ill, but we're all ill at some point. This whole thing now, this exclusivity where you walk in, you go, quiet in here, isn't it? And then you walk into a treatment centre or a hospital and it's literally heaving
because they're passing
because the GPs are sitting there going, oh, what shall I do then? Yeah. And again, any GP listening, I'm sorry if that upsets you, but that's how it looks to the people outside. That is how it looks.
Last time I went, and it was my surgery, which I think yours has as well, but it's a different surgery. So mine's was one surgery, now it's like 3 different practices that have amalgamated into one. And I had to go to a different surgery for a problem. And actually, I've got to be honest, that problem, that issue at the time, they were brilliant. I actually got seen quickly, I got sorted quickly, I got referred quickly, and that was all great. And that was a good experience, as in for my situation. But I was sat in this different surgery, which had all been poshed up, by the way, and there's 2 more people in there, 2, right? And they were struggling to get me that appointment. And I'm thinking, well, where is everybody? Are they on the phone with the phone appointments? Is that what they're doing all day? I mean, I'm not saying they're doing nothing. I'm sure there's a hell of a lot of paperwork that comes with it.
Yeah, and I'm sure we're ignorant to what goes on behind the scenes if you're not in that environment, but it still don't look right.
Yeah, like Jane said, you go in the walk-in centre, which is local to us, heaving. And the last few times I've been in there, You literally, there's nowhere else to sit.
Well, thankfully, someone very kindly got up so my mum could sit down, because I think even they could see she was in pain. I actually, because I don't go in there if I can help it, I really truly don't. And I don't think I've been in there. Well, my stepmom fell over. There's a little bit of a trend going on with my older relatives at the moment.
Yeah, don't you start.
Yeah, but the last time I was in there was when, I mean, this is a prime example, when the ambulance was called to me when I broke my leg. I knew I broke my leg. I couldn't get up. I tried to get up. I couldn't get up, and I'm a stubborn whatnot. So if I could get up, I would have done. And the ambulance was called. It arrived an hour later, and their first things were, let's pick you up. You've probably just torn a leg, bruised yourself, and a little bit of ligament damage. And I went, please don't pick me up. Please don't pick me up. I heard it break. And they picked me up, and my leg was like a Christmas cracker. And then they went, we'll pop you in your own car, and your daughter, because she'd arrived dead, thinking she was driving my car home, your daughter can take you to the treatment centre. Because it's COVID, we can't take you to the hospital. So my daughter had to drive down the motorway with me in the car licking the window because I was in so much pain, because he'd swung my leg into the footwell, and it took about 30 minutes, my daughter reckons, to even get me in the car because I was in so much pain. And I'm gone grey, and I've arrived at the treatment centre, and my only vivid memory of it is the doors opening and shutting because Amy drove so close to the doors. And they came out and started having a go at her that this is a treatment centre, she needs to go straight to QA. She's getting upset, telling them that the ambulance crew wouldn't take her. They said I had to bring her in. They've put her in her own car in the passenger seat. And I'm literally in my head wanting to say the things that I wanted to say. And I'm not normally that rude, but I'm in pain. But I couldn't even speak. And I think when she opened the door, she realised how bad I was. And I remember being boarded onto some wheelchair. I can't remember a lot of it. I was in trauma by now and in shock. But they x-rayed me. But now you can't be x-rayed at the treatment centre. I've just found that out yesterday.
Oh,
so that's
really?
another... No, don't x-ray. But
they did it a few months back.
She says they don't x-ray no more unless it's an absolute priority. So I think people say it as they go along anyway, because I went, well, you got an x-ray sign there, so maybe you want to change the department. But anyway, they had to board me and slide me and all that. Felt like an episode of Casualty or ER. And next one now they're going, really sorry, we need to blue light you straight to hospital. You've got, on a scale of 1 to 6, you've got a 6, serious break. By this point I was out of my mind. I was begging for the morphine, even though I'm sensitive to it, and it just got all out of control. So again, that was prolonged. But I kept thinking, how can you leave someone just because it's COVID? How can you leave someone?
Oh, well, yeah, that's it.
How can you go? And obviously they did more damage picking me up. That's what mainly damaged my leg. And they were lovely paramedics. I can't fault them in any other way there, but they wouldn't listen to me. And I heard my leg snap straight through. I broke both bones, and I heard, it was. I'm a toughie, but even I didn't like the sound of that. There was just so much that I have experienced, and I know we have it as a joke, and it is a standard joke, that I have experienced a lot, and I do seem to attract some of that crap, but maybe it's because I'm accumulating it and thinking this is wrong, this isn't right, this isn't happening. And I know other people that go, oh, just get on with it. And I've never put a complaint in, I've never sued them, and I think I could have done that. I just watch so much and get so frustrated because I think, how bad is it going to get? I am in my last year of my 50s. My mum is 82. I sat in that hospital last night wondering, I know it's broken our NHS system, but I think other countries are stretched now with even their private systems. How bad is our medical care going to get around the world?
Wow.
Are we really going on this, they want this digital ID? It reminds me of a film with Justin Timberlake. What's it called? Time Out, where you literally only you go to eat something, they go, no, you've had too much of that this week, you can't have it. You go to, say you went to go to sleep, they go, no, you've already had 8 hours, you can't have no more. It's an interesting film. It is worth watching.
I certainly wouldn't be on the, you've had 8 hours.
Yeah, well,
I might get 8 hours in 3 days.
I watched it years ago, but it is interesting, and it has come back into my head because of this whole online system. I mean, the internet was down here locally for me. I had no internet. So again, if the internet goes down, we can't record these podcasts. We do a lot of work on, we won't be able to go ahead with that. We all use our phones. All this medical system has gone online, gone digital. I have an AI doctor I had a robot doing my last surgery, so actually I'm not going to knock that because they did a brilliant job. The doctor was behind it, I think. But we're going to have like robots going, hello, how can we help you today? And
we laugh about it, but it will.
Now I'm saying, go, and anyone who hasn't watched this film, go and watch Time Out. And anyone that's heard of the digital ID, they're not in this country. Britain's being talked about having digital ID. If anyone hasn't heard of it, look it up, because that is where I think we're going. And it worries me that it was the way the NHS is going and other services are going, and this tier of people will be on 3 levels. If you're not very well off, you might as well just start going to find yourself a little cave now. It's just worrying where I think, where are my grandchildren going to be? They're so young at the moment. Where are they going to be?
At some point, there's going to be, there's already marches for quite a lot of things at the moment, isn't there? And it was like back in a few years back, it was like the nurses and they're basically saying if they weren't jabbed, then, they can't work there and what have you. And I don't blame them for marching. I'd have joined them. Because, we're already stretched. We're already, stretched to the limit, totally. And like you said, at some point, there's going to have to be some sort, either something done about it. Everyone's going to have to moan, kick off, march, I don't know. We either do something about it, or...
As you're talking, I've got Mad Max coming into my head, and that was back in the 80s. So,
or we have to just go with whatever weird system we get and hope that anybody that can't afford private medical care, which I do feel like it's going to be so pushed there that everyone's going to have to just do it.
I'm already paying for a private dentist. My dentist came off the NHS and the private, and I'm paying for him, and it's not ideal, but I need to go to the dentist and for when my teeth fall out, so I'm going to need him at some point. And I go to the hygienist, so I paid for it, but I'm probably, if I work it out, paying more a year now to see the dentist than I did when I paid on an NHS subscription. But I'm doing it because at one time I probably will need more treatment, and I don't want to not have that opportunity because people lost a dentist when they couldn't afford private. I suppose because we do keep these shows reasonably short in case you've already switched off and got bored with us anyway. And we're always going to bring, like I said, an element of spirituality in it, and we could talk about the NHS for about 100 episodes. Actually, a lot of our subjects we could talk on an ongoing situation. I think because it was so raw yesterday and I've experienced some trouble with the pharmacy, I've just felt, well, let's talk about that one first because it's
a lot of people we know, especially spiritual holistic type people, they're really going for the plant medicine.
Well, that's why I was gonna just swerve this now before we end. I was gonna swerve in the holistic. Oh, let's go holistic and spiritual and love and light. And I have, like I said, I did house studies in uni. I then started studying holistic stuff, and I've done metaphysical stuff, and everything I do is more on a holistic side. I don't take a lot of medication for my long-term conditions. I do my asthma. I'm not silly. I need my lungs open, obviously, to breathe, but I look at alternatives to help with some of my conditions. I manage my conditions quite well because I'm holistic. And I think there is a time and a place you do need conventional. So I wouldn't say I don't agree with people that don't have any treatment because sometimes it is necessary.
But it is also their prerogative if they don't want to have, worst case scenario, they don't want to have chemotherapy, but that's their prerogative.
Yeah. There was a case recently, though, where a young girl didn't have it because her mum encouraged her not to do it holistically, and she has passed away, I think.
And that's the thing.
And that's
like
where
I said, it is your prerogative at the end of the day. My mother didn't want it in the end because she knew that it would only give her borrowed time, and she wanted to go with some dignity, which we have to
respect. I suppose from the holistic side, I just think if more GPs, more medical people had a little bit more insight into a more wellness way of living, because I'm all about the well-being, that maybe if they concentrated more on helping people with their emotional thoughts, because emotional stuff always leads to overeating, and my weight goes up and down, and I know it's a lot to do with stress and my emotional state. If they concentrated more on that and helped people to understand why they eat badly or why they're
emotional,
and looked at all that and conditioned them to be more happy in doing things instead of going, take this, that, go away, or do that. And actually that pill's going to make, they say pill is actually got ill, the word in it. That's going to make you better, but it doesn't, because a lot of medicines counteract each other out.
Oh, absolutely.
As does herbal. People still got to be careful with. There's lots of treatments that counteract each other out.
Ashwagandha, right? Somebody was saying like buzzing about ashwagandha, saying, now my blood pressure is, the highest my blood pressure is normal. So my blood pressure has always been relatively low. And I took ashwagandha, I thought I was dying. I couldn't even feel my heartbeat. It was so slow, and I had no energy, and my blood pressure had dropped so much from taking ashwagandha. So you do have to be very careful.
Well, you need to go to a reputable homeopath or apothecary. Is that it? Apothecary. It's the other name for someone that works with herb. A herbalist or a homeopath fit, whatever, anyway. But anything like that. But when you go to them, you need to go to a reputable one, and you need to tell them what's wrong with you. Yeah. And they should be asking that in consultation. What medications you may be taking conventionally, so that they make sure anything they give you does not counteract that out. So you can't walk into the local herb store on the high street and just pick it up and ask them, will this to be all right? Because they go, yeah, they're not medically trained to tell you yes or no. They're assistants.
Like going into somewhere like Holland and Barrett. I mean, because you've read something's going to be great for you.
Oh, let's go and get that. Or buying online.
Yeah. And I've done it myself. With the ashwagandha, with other things where I've thought, yeah, they've said that's going to be great, and that it's maybe in a better dose, a smaller dose, or not quite such a, because a lot of things people like, oh, buy at a high dose.
But also buying online. That you've just reminded me, you were buying B12 patches online, and I was like, what?
Do you know what?
I inject B12. She didn't come to me for an injection.
No, I did ask you once.
Yeah, you thought you had to have to go to the doctor to get a prescription. I've got a doctor that prescribes my prescription, so I am fully insured, qualified with a prescriber to do that. But that's interesting because so many people buy stuff, and we're not going to name online shopping channels, but they've been known to be said that there's a lot of fake accounts and people selling stuff on there. But I know, doing my vitamin stuff, which is genuine vitamin stuff, it's the same as what the GP practices uses if they're ever open and seeing people. Just get that in. And I am a prescriber, but people are going online buying them really cheap, and they don't look the same because I've had a little look. And then people are having them injected into their bodies or putting things on like a patch, because you don't know what was in your patch. You've just bought it.
I don't know, but they do actually give you a good old...
Yeah, but they could have a lot of other things in them, like these weight loss injections that people have bought away from the...
I wouldn't do that.
But people don't know, but they think, oh, that fixed me. Oh, I can't afford it, but that's cheap. And this is where, again, the holistic side is getting messy, because you must go to qualified, insured people. And you must buy from reputable people. So even if you buy online, who's giving you the guidance that's going to work?
Well, again, like you said, if you've got something else wrong with you, something else that isn't normal or isn't right, and then you take something that's going to basically... It was like, I remember somebody else saying, saying, I feel like somebody told me I should be taking B9. I don't even know what B9 is.
There's another B vitamin.
Is that folic acid or something else? I don't know.
I want to say flavin.
And I said, well, was that through a blood test? And they went, no. Well, they just said that could help. And I said, but what if you've already got enough B9? Maybe it's something else.
To be fair, as a vitamin technician, and obviously that's a whole nother show. Most of us now, with our poor diets, our lifestyles, our stress, we don't hold our vitamins enough. Somebody like you that's celiac and obviously dairy and gluten intolerant and all that. Yeah, you're not your body and your gut would not be holding stuff very well. Vegans wouldn't be holding stuff very well. Vegetarians wouldn't be holding stuff, because a lot of it is found in meat and protein. And also we've got to eat a lot of it to really affect us. And you can't suddenly eat it now when you haven't been eating it all your life either. It's like most things. So we're probably all lacking somewhere, but some of these, like I do vitamin D, you can only have that 2-3 times max a year because it's such a high dosage. Not everyone can have that, whether it's a vitamin or not. And it really needs to be, that's what I'm saying, addressed.
Vitamin D makes me feel...
B9 wouldn't have been the end of the world because it's one of the Bs, and the Bs are a little bit more what I call safety, but nothing is 100%. Nothing. That's why I have to do consultations. That's why the doctor has to do my prescriptions. So yeah, it's all a bit worrying really, but we could go on forever with that. We could. And we have had a bit of a moan today.
Moany.
That's because we've had no sleep.
Yeah.
When you've only had 3.5 sleep.
But we haven't been moany. We've been 30. We've been observant of the system, and we've both been in the system, and our perhaps relatives have been in that system, and without a doubt you guys at home are going to have been through the NHS system, or a system where it might not have worked for you. You might have had great experiences as well, like I've said the eye department's been brilliant with me. This other situation I had, brilliant, seen and everything was really, really well done. But there is also some massive flaws. So we're going to leave you for today, but let us know what you think when you watch this. Do comment on YouTube or however you're watching this.
It goes out on YouTube and Spotify now, and it will be on Apple Podcasts. That's the next one to load it on, but it is on Spotify and YouTube now. Just one last thing though. When you are struggling to get support for your medical conditions or you need some help, don't be afraid to speak out. That is something I've watched, especially with the elderly, but especially with a more quieter soul, which is certainly not us too, but somebody that wouldn't want to disrupt the system because they believe that people in important jobs there's trust.
Lots of trust.
That's a very English thing that we've all grown up with, I think, over the years. It's changing a lot though. But you must trust your gut. And this does go back to us. Like, you always trust your gut. If you think there's something wrong, if you feel something's not right, if you feel you're not getting listened to, if you're not happy with your diagnosis because you still don't feel right, you must go back. You're not bothering anyone. You're not, because this is about you. Only you can look after your own body. Only you can take care of yourself. So you've got to do that. And more people do need to speak out. Not argument, and not obviously in an aggressive way, but you have a right. You have a voice.
Yeah, in an assertive way.
And you must do it. Because I know yesterday my mum would have accepted a lot, well, she did, sat in there, didn't tell me about triage, and because of her age, where I then was like, oh, I'm not having this, but people need to trust their gut. So we will leave it back on our spiritual gut level.
Absolutely.
With our probiotics.
Be assertive. Be assertive for your family as well. And
take care of yourself.
Absolutely.
And we will see you in episode 4. Thank you very much, people. Bye.